I just returned from Curacao, where we had excellent meetings about healthcare. You know, as we're working on building the new hospital, as everyone has always said, the hospital is just a building. We need to make sure that the quality of our healthcare system is up to par, starting now, of course, but also especially as we gear up for a new hospital. So we had a meeting in Curacao. Actually, the three ministers, so Minister of Health from Aruba, from Curacao, and obviously myself from St. Martin. We went with a good-sized delegation from each of the countries. The point was to bring representatives from the public health insurance entity from each of the countries, from the hospital from each of the countries, and from the ministries, in particular the ministries of public health from each of the countries. And the idea is, again, to share our best practices and our mistakes, our lessons learned with each other so that we can do a better job and hopefully more economically and more efficiently. We all have similar problems. Small countries, small economy of scales, limited human resource budgets, limited human resources, and limited financial budgets. And we're all looking really to accomplish the same goal, which is to deliver the best quality of care that we can for our people. And so we had 2 days of intense meetings, and as an outcome from this meeting, we believe that it was good to agree on clear ways forward. And so we've signed a collaboration document just to really document where we are going forward. I'm just going to point out some of the elements that were agreed upon. So each of the different sections broke out into their own groups. So from the hospital committee, there was 3 top strategic collaboration objectives. Collaboration on centers of excellence. So as we look, we see that each of the hospitals is sort of focusing on particular areas of care. I saw in Curacao, for example, the NICU, or the Neonatal Intensive Care Unit, is quite developed, and so they're looking for the different islands to send their patients for that particular need to Curacao. Both Curacao and Aruba are working on a LINAC, or a linear accelerator, which is a treatment for cancer. Very expensive. To be honest, I think there's a question as to whether they have a population size to support it, especially since they're putting in 2 very close to each other. But again, they're looking at how can they specialize, because even in that area, there's ways for them to specialize in particular treatments. So we're again looking between the 3 countries, how can we cooperate, avoid that we're competing with each other as much as possible, and support each other. Also, training exercises and exchange of personnel is some of the topics that they're talking about in terms of making each of our hospitals a center of excellence. Quality and safety standards. All the hospitals now have agreed to work towards JCI accreditation as a standard. So what this means is that we're all trying to use the same standards as we move forward, which is, again, excellent in terms of how we share our resources. But this looks also at the protocols that the hospitals are using, especially since we're referring patients back and forth between the hospitals. The protocols should be as similar as possible. It makes transitioning or exchanging of patients, referral of patients, smoother. But also legislation, also logistics, all of those are areas that they're working on in terms of safety and quality. And obviously procurement. You know, you have 3 hospitals that are spending a lot of money on pharmaceuticals, all types of materials, and equipment. As you know, all the hospitals have very sensitive, very highly sophisticated equipment. So again, if we can synchronize and purchase the same brand of equipment, it means that as we look for maintenance contracts and for service technicians, if we're all using similar equipment, it makes it easier to find better quality technicians to service it. And again, hopefully we can leverage our purchasing power so that we can get the best bargain for the country. Software programs in particular, when you're managing patient data, is extremely expensive. And all of the hospitals have had stories of troubles with their software programs. So again, that as each one has gone through and evaluated different programs, the pros and cons, those are lessons that can be learned and shared with each other. And again, ideally, I'd love to work towards one software program for each of the hospitals, again, just making things more efficient. The public health insurance entities. You know, there was already a cooperation agreement between Aruba and Curaçao for their public health insurance companies. During this trip, St. Martin was also added to that cooperation agreement. And again, it's a very small step, but actually it yields big results very quickly. You know, for example, just exchanging data in terms of people that are on the lists of SZV but actually have moved perhaps to Curaçao, that information wasn't really being shared, and now hopefully it would allow the insurance company to have a more up-to-date and accurate list. It's just one example of a very simple way of cooperation. But also they're looking to benchmark against each other so that they can get a better idea how they are actually performing. Medical referrals, very interesting. You know, their medical referrals are much lower than St. Martin's. It shows that, again, we're on the right track with building a new hospital. We need to find a way to make sure that the patients can be treated locally with obviously high quality of care. And that money is money that would circulate within our economy rather than being sent abroad. So that creates jobs, it creates turnover. It's just the right way to go. But again, as we benchmark our referral programs against those of Aruba and Curaçao, we can see that, you know, the lessons that have been learned, and looking at referring patients to the same hospitals, again with the idea of trying to bulk our purchases together so that we can get the best value for dollar. Pharmaceutical costs, this is something that we all want to work on. Aruba and Curaçao have already made further inroads than St. Martin, so we are learning from what they've done in terms of how they brought down their pharmaceutical costs, sharing legislation, and again, that's, again, I believe, to St. Martin's benefit. Similar with IT and data, again, these are very IT-intensive businesses. We're looking again at sharing software platforms, how we can be more efficient, and what lessons they've learned. The Department of Health, 3 priorities: formalizing an agreement mandating that the policy departments responsible for public health on the islands join forces for the implementation of short, medium, and long-term activities regarding policy and legislation. So one of the primary functions for public health is the drafting of legislation, for example, topics like syntax, like our NHI, so how we can share what legislation's been done already and try and borrow from each other the elements that make sense for our particular country. Working on lifestyle programs. You know, there's a couple programs that I saw in particular that caught my interest. You know, at St. Martin, we have a health bus. There's been some issues with the way the health bus has been running in terms of the results. We want to make sure that the money we're spending, that we're getting better results. And Aruba has a health bus and I think is performing very well. So they are sharing their information with how they run their program in Aruba so that we can look to modify ours. In Curaçao, they have a program called Biba Amor, which is really a program geared towards reproductive health. How do they advise people in the population about sexual education, in particular working on reducing teen pregnancies. I think that's something that, again, there's a lot of need for in St. Martin. How can we reduce teen pregnancies in our community? Establishing high-quality norms for healthcare institutions and medical professionals. We're looking at trying to balance these norms against the 3 islands. In other words, each of these islands should work towards an equivalent set of norms in terms of quality standards for healthcare institutions, obviously in particular the hospitals. Standardizing establishment procedures for specialists. Each of the islands, we believe, should try and synchronize. And it would also make it much easier, for example, when we need replacement physicians, that if we can just draw simply from Aruba and Curaçao without all of the cumbersome approval processes, this would make it much easier for us to access specialists when we need them, and also in cases where specialists are on vacation, this would allow a fill-in to come in much easier than it happens right now. And again, an exchange of data. So overall, I'm very happy with the results. I'm also pleased that we've already set the next date for October 26th and 27th here in St. Martin. So this is medical tourism. This is representatives from Aruba and Curaçao coming to visit our country, an opportunity to show them how we do things in St. Martin and how we can learn from each other's experiences.
I just have a few remarks. I'll start by giving an update on a question that was posed in one of the previous briefings pertaining to the life insurance policies for the workers at the ministry. Those policies are being signed off right now by the Secretary General of the ministries, and hopefully by the end of the week, all employees would have their policies in their hands. So that chapter has been finalized as far as the life insurance policies are concerned. The release was made and it appeared in the newspaper and in the National Gazette pertaining to the extension, the general extension of the gun policies. And based on that, the ministry has received a lot of queries, but a lot of those questions were circled around one particular point where it was being asked if someone in my family had a gun permit and they pass, what then? And I think it was mentioned in the policy and in the extension that a gun permit is not hereditary. It doesn't pass on to anyone. I just want to make that very, very clear. So if someone in your family had a gun permit and unfortunately they passed, then I would strongly advise to take that weapon to the police department and deposit it there. Otherwise, you could be facing charges for illegal gun possession. There's a point that is very disturbing that I want to touch. It was an article that appeared in the newspaper about an elderly woman who was attacked and assaulted. And first, let me, my feelings of how you say, to the family, sorry that something like that took place. But the picture in general, where an elderly woman would be assaulted in such a fashion, should make all of us sit up and, as we say, smell the coffee. Luckily, this is not something that happens every day, and I don't want to make it sound like it is a common something that happens every day. But it should make all of us reflect and ask ourselves, where are we going? What is happening in our society? Last week I mentioned about, I touched the fact that many of our violators are very young residents, very young folks. And we are seeing a breakdown in society as it is, as far as these crimes are concerned. They're getting more violent, more heartless, and it's about time that all of us start paying attention. I would be getting together with my fellow ministers, especially ministers of ASA and education, and I think, and we'll be proposing to organize sort of a forum, a reflection, if you may call it that, with the relevant community leaders and stakeholders, and for us to just reflect on what is taking place, not so much the crime itself, but the breakdown, what is causing our youngsters, etc., to be acting in this way. So I just want to mention that, and that it is all of our responsibility. Once it happened, it becomes the police responsibility. But in situations also where you would have in our communities where there are a lot of elderly people, for instance, living alone, and as neighbors, etc., we should also try to pay attention to what is going on with them and look after them. So I just wanted to mention that because it was very, very disturbing what took place. Later this afternoon, I will be meeting with a delegation of government from Anguilla, headed by their chief minister, Minister Banks, and it would be discussing immigration matters. As you know, that Anguilla, to a great extent, is dependent on St. Martin's Airport for a lot of the visitors who go to Anguilla, and sometimes problems arise with the visa issue. And there is an agreement with Anguilla, between Anguilla and St. Martin, for residents of Anguilla who are for whom visas are applicable to enter St. Martin, but they are legal residents of Anguilla, and sometimes, and when going on vacation or going to different countries, they have to pass through St. Martin to get to the airport, and the period that they take is longer than what is considered a transit period, and sometimes that cause some issues. So we will be sitting this afternoon with the government of Anguilla, and we will be discussing these issues and reviewing the agreements that are there and see how we can facilitate the situation without hampering ourselves. Tomorrow also there will be a meeting with the Progress Committee. And you know, the Progress Committee is charged with the reporting on the plans of approach and the progress of the plans of approach for the police and the prison. Thus far, we have been doing pretty okay, in the sense that the reporting is less negative than it used to be. We look forward to that meeting. It is very important. Also because of the fact that St. Martin, for the first time in many years, would have its own representative on the committee, as Mr. Jason Rogers was recently appointed as a member of that committee. So after, hopefully in the briefing of next week, I'll be able to give more information on those two meetings. And thus far, my comments for this morning. Thank you.
Within sports, the Ministry of Education, through its Department of Sports, has collaborated to be able to assist Mr. Raphael Skeet, who is a local St. Martin Pro Ball player who played with the Baltimore Orioles and is coming with a team from the Piper Davis group to do some workshops here on St. Martin. Mr. Skeet currently resides in the U.S. and has been trying to collaborate with us for some time. So we are happy that he will be arriving on the island today and will be hosting a sports scholarship training. The training will consist of imparting information related to college admittance, as well as playing sports in college, so specifically for athletes. This will also be done in workshop fashion and will include SAT and ACT preparation for the test. The goal of the training is to ensure that our athletes are fully equipped with the knowledge of collegiate sporting and also on the collegiate admittance procedures and requirements. In an effort to assist student athletes who are interested in the tertiary level of education, students, coaches, and the general public are invited to attend these training/workshops. They will take place at the Little League Stadium starting on Thursday from 5 p.m. through Saturday. For more information, you can contact the Department of Sports at 542-2056. So we are very, very happy to be able to collaborate in this respect. Also upcoming in August, we have the Caribbean Wellbeing Conference. It's a regional conference that is held every year, and this year will be held on St. Martin in collaboration between the Youth Council and the Student Support Services Division of the Ministry of Education, Culture, Youth and Sports. It starts on August 6th and ends on the 8th and will be held at the University of St. Martin. This conference is to promote the positive development and well-being of children, parents, families, schools, and communities. The CWBC aims to inform and educate on best practices to promote children's well-being by looking at the important role that parents, families, teachers, schools, and communities play in the promotion of well-adjusted, socially and emotionally competent youth. And in listening to some of the ills that are cropping up in our society, we can say that it is well past due that we can host that here. It will bring together educators, administrators, social workers, counselors, psychologists, therapists, community leaders, practitioners, parents, and all those working in promoting student wellness from St. Martin, the Caribbean, and the wider region. The Caribbean Wellbeing Conference also hosts free parenting sessions. So this is a paid conference for the professionals in the field, but parents are also given the opportunity to take part for free, and this will be on Monday, August 7th, on the second day, at the University of St. Martin. They are open to all parents and guardians and the general public and starts at 6:30 p.m. The workshop is entitled Parenting Through Mindfulness, an introductory workshop, And at 7:30, there will be a panel discussion whereby attendees will have the opportunity to ask questions pertaining to the well-being of their children to the panelists. For more information concerning the Caribbean Wellbeing Conference, please contact Mrs. Olga Mussington Service or Tamara Groeneveld at the Student Support Services Division at telephone 543-1235, or you can also contact the Youth Council. This is a great collaborative event, and I look forward to the results and awareness that will come from such sessions. We do have Student Support Services Division working yearly throughout with our students with special needs, with the schools, and we've recently been able to take it to the secondary level. But of course, as always, they keep insisting that they need more personnel to deal with the challenges that continue to grow. So I think in involving the community, involving parents, we should be able to bring down the need for as much interventions as we are seeing in the past few years. So I wish them much success with that. In news from the Division Study Financing, yesterday evening, the Division Study Financing culminated their sessions with an informative session for students and their parents who are leaving the island to further their studies abroad. The students were given information on studying abroad, the students and their parents, of course, survival skills, and got to voice any pending concerns or issues they may have and get those answered and dealt with. On Sunday upcoming, July 30th, the students leaving for the Netherlands, as well as students studying in the region, are invited to their Bon Voyage ceremony, which will be held at the Princess Juliana International Airport. So usually it's only the ones that are leaving at that time, but all of the students who have been awarding study financing will be able to take part in the session. And some 30 students will be traveling to the Netherlands that afternoon, along with 2 Division Study Financing officers. The ceremony will begin at 1 p.m. and I would like to take this time to congratulate all those students who have done their due diligence in completing their secondary education, applying for, qualifying, and being awarded study financing, which is an assistance that they will get to be able to complete their tertiary education. I wish them well. I wish them much success in keeping their focus on what they are going to do. And I would like to also take the time out to thank the Princess Juliana International Airport and the Domino's Pizza for co-sponsoring the ceremony. In general information, the ministry is proud to announce that we are collaborating in a back-to-school drive with young Kimani Olivachi. This is the second year that he has done this. We have endorsed him in the past, but we've actually joined the drive in a sense of asking persons to sponsor, and I'm going to implore via this media, of course, my colleague ministers to donate some bags and school supplies. But not only that, we have also been receiving even articles of uniform clothing. You can do gift certificates at the various outlets that sell uniforms and or school shoes, as there are many in the past, organizations that are working towards this same venue, this same type of event. So we've decided, instead of doing things separately, to collaborate. I'd like to commend also the Strictly Business Foundation, who's also doing that. So the community out there, you have several ways in which you can give back to the community by helping those less fortunate. Usually the foster children are the focus, but we would also like to include families who may be having their children with them but are still having a hard time providing the necessities. We can also get some names, I'm sure, from social services, because through that venue also they are able to get some assistance for contributions for their obligations to the schools, as well as school uniforms, etc. But we all know that it doesn't always meet the need completely. So as a community, I implore you to assist with this drive. It started since June 19th and will end on August 11th, whereby all the bags collected will be giving out on the 12th. I commend the 16-year-old young man for starting the initiative and wish him continued success in being innovative and community-minded. So even while he's away on his own personal development as an athlete, he started it. He has areas designated where you can drop off your bags. And since we've joined the drive, you can also drop off bags with supplies and or gift certificates right here at the Government Administration Building. Just request at the Bali downstairs to see Miss Rolika Roach of my cabinet, and she will collect these, and then together with Kimani, we will be delivering on the Saturday, August 12th. So I look forward to the community to continue to support each and every effort, especially of young people like this, to make an impact in their communities and assist the needy. Thank you.